Thank you so much for coming and joining us for this conversation this evening. My name is Kara. I'm the communications manager at Partners, and I'll be moderating this conversation tonight. This webinar was really born out of the questions that we've been receiving from across our community, asking about how the USAID briefing is impacting the communities that we love and are partnered with. And while we haven't received any funding from the US government as an organization, we are seeing the alarming ripple impacts that this is having on communities that we walk alongside, communities that are often the most vulnerable people groups in the world. For us, this is not about politics. This is about kids and the fact that we so deeply believe at Partners that kids should not be suffering when adults are fighting. For anyone who might be new joining us tonight, I just want to give a really brief background on who Partners is. We are an organization whose heart and mission is to see kids impacted by conflict and oppression living free and full lives. We do this in two ways. The first is that we provide rapid emergency relief to families in crisis. And the second is that we partner with communities to develop together solutions in areas such as healthcare, education, and livelihood to really help communities either rebuild after conflict or to help them as they're riding out the waves and surviving through conflict. Tonight, you'll get to hear from our Southeast Asia Director, Noom, and our Middle East Director, Brad. Brad sadly isn't able to join us in person. He's currently in Syria, and I believe it's around 3 a.m. there, but he did send us a video update, which we'll get to share with everyone here tonight. After that, we'll segue into time of Q&A with our Director of Operations, Doug. So if you have any questions throughout this webinar, please feel free to submit them in the Q&A section at the bottom of your screen. And we would, really love to just delve into a conversation portion at the end of the webinar. Before we begin, I just want to take a quick moment to invite us all to breathe deeply and take a moment to ground ourselves. I know tonight we're going to hear stories of very real suffering that is happening, and we're also going to hear reasons for hope. Lately, something that I've been reflecting on a lot in my own life is just how when we're grounded in community, when we're grounded in love, I think it really creates a safety net for us to come together and bear witness to suffering, and then to be able to take all the emotion that we have and to allow it to move us into walking out love. It's real that the suffering is very present. And it's also real that that doesn't have to be the end of the story. And we get to be a part of creating a different ending. It's really a treat. I get to pass the conversation over to Noom, our Southeast Asia Director. Noom is just a wonderful guide and leader to our operations team in Southeast Asia. He is also an incredible wealth of knowledge on all things philosophy and history. I'm always learning so much from Noom. Noom, thank you so much for being with us tonight and for coming and just sharing your knowledge in this really important conversation. I will pass it off to you.
Okay, thank you so much, Kara. I'm Num. I'm overseeing Southeast Asia operations, basically Thailand, Myanmar, and Bangladesh. So I want to describe the impact as a ripple effect, which affected globally and locally. So let me give you a big picture how it affects on overall, not only health, but also other needs from for the refugees, IDPs, or the internally displaced persons or home displaced and normal civilian, so that you see the gaps. So first, let's begin with healthcare in the refugee camps. So around Thai-Myanmar border, there are 9 official camps with 8 86,000 refugees. So this is the official number on the list, but the actual numbers are more than 100,000 populations. So the organization called the International Rescue Committee, the IRC, is the main donor funding for the healthcare, medicine, and paying healthcare workers for the 9 camps. So the IRC is the main donor. So on the 27 January, the IRC officially suspended its project. So the only emergency care and delivery cases, the clinic are able to continue until today. For example, someone with kidney failure and needed to be taken to a nearby Thai hospital to get kidney dialysis. But the other department, for example, like the OPT department, has totally stopped now. So after a few days of suspension, ISCAM had to form a new committee immediately in order to find new donors to fulfill the gaps. So we have heard that the nearby Thai hospital can take some responsibilities, but we don't see yet in practice. So until today, I think no one has given promise any concrete commitment yet. So, okay, this is the short update situation for the health-related issues in the refugee camps. So let's talk about how it affected on other needs. So there's one organization called the Border Consortium. So this organization has been feeding the Myanmar refugee and the IDPs since 1991. So currently it is feeding the same refugee groups, like the 80,000 refugee across the 9 camps. So it is the same camps where the IRC is providing their health services. So the border consortium is feeding the refugee like food and cooking fuel, at least 1.3 million US dollar per month. And the organization has announced recently the money that it has only enough to last for a month and a half. So this is the direct impact on the refugee living in the camps. So I would like to continue talking about the internally displaced people. So this one organization called the Committee for Internally Displaced Korean People. This organization is providing humanitarian aid to the IDPs in current states in long time ago. They are helping with for example, local governance process, financial assistance, communication equipment, first aid, and basic hygiene kits. So the organization said that right now there are over 752,000 war displaced population within current states. But across Myanmar, there are over 3 million people have displaced and homeless. So the organization has received confirmation from its donor to suspend all their operation that I have mentioned. Yeah, also at other region, for example, like the Shan IDPs, there are 5 clinics that used to get medicine and other emergency costs from the IRC too. And all the clinics are facing this, the same problem as the refugee camps. One example that I would like to give you, there's a clinic aiming to conduct a mental health training within this month for the drug addicts and psychological effect of war for the civilian, but they had to cancel the training because of no funding. So now I would like to move to another region. So Deb, could you show the second map, please? Thank you. So now I would like to move to China border. So on the other side is Kachin State within Myanmar, bordering with China. So there are a few IDP camps too around the border. So, but I would like to talk only. I would like to talk about only one camp. So one of our staff members' wife, she's a nurse. She is working in a camp called Pagodong. I don't know whether you can see on the map because it's too small. So the name of the camp is Pagodong. So there are 3,056 people living in this camp, only one camp. So she said she doesn't know how who is funding for the healthcare services, but the clinic is facing the same problem as others too. Yeah, she said the clinic ran out of medicine now. So many patients are coming to clinic every day, but no medicine to give them or to give treatment. So the most needed is medicine for kids. It is now seasonal changes, changing from cold season to hot season with pollution. So kids are easy and often getting sick, but no medicine. And also, there's no way for them to take to take their kids to the government hospital because of the fighting. And also, it's not easy for them to cross the border into China and to send patients or to send their kids to get treatment in the hospital in China either. Yeah. So the gaps are huge to fulfill. So what can we do? So I believe there will be other donors to fulfill the gaps, but when and how long it will take, I think it can take time. So we partners, we have many years of experience working directly with the communities. So we have the context, we have the access, we understand the situation very well, and we know the needs. So if we can have funding, so we can, yeah, we can do project delivery directly, or we can work to our context. Yeah, we have our context in every state. For example, like different state within Myanmar. Okay, thank you.
Thank you so much, Noom. Your just insight is so helpful to this conversation. Um, I was really struck when you were talking just how the needs are so complex when it comes to families being in the middle of a war zone. You know, if you have one clinic that you can go to and that clinic closes and you're surrounded where you can't travel freely because of conflict going on around you, just how much more difficult that becomes and how that, is happening across so many different needs, not just healthcare.
Yeah,
Yeah, thank you again for sharing. We're
you're
gonna
welcome.
we're gonna transition now to hearing a video update from Brad, who is our Middle East director. Brad has been traveling recently across many of our programs in the Middle East, across Iraq and Yemen, and he's currently in Syria. So we're grateful that he took the time to send us this update.
Hello, everybody. My name is Brad. Thank you for joining us tonight. And I apologize that I can't join you in person, but I'm currently in Syria. And as you can imagine, the effects of these recent cuts in humanitarian spending are being keenly felt here. The problems are being compounded by the recent collapse of the Assad regime that caused tens of thousands of families to flee to the northeast Kurdish region in Syria. And many of those families are living in or near camps. And that is where many of these gaps are being felt, as NGOs that have had to stop their work often did work in these camps. We have been visiting some of these camps lately, and at one, we were told by the Kurdish administration of the camp that the organization that was in charge of ensuring the smooth operation of the camp informed them practically overnight that they would be stopping all services. They told us about how terror is the word they used, spread through the camp that night as families heard that there would be no bread distribution the next morning. Fortunately, one of the NGOs that had been doing bread distributions was able to do it the next day, but nobody knows how long that will last or if it will at all. And unfortunately, we've been hearing so many stories of this fear and uncertainty. We talked with one family that described how they were hoping to be accepted into a camp where they could receive aid of some sort, and were anticipating that being at the beginning of this year, but due to the funding cuts, that did not happen, and they are living in dire need still. We also spoke with the Humanitarian Affairs Office, and we told them that partners would not be stopping our work, that we would be continuing, and that we would not be leaving. And their faces lit up. They told us that's the best news that they've heard in this entire time, because they've been having meeting after meeting with organizations that are telling them that they have to stop their projects, cut their funding, and that they don't know when or if they will be starting up again. And they asked us to increase our help in pretty much every area. Urgent food distributions, clean water, toilets, medical aid, heaters, appropriate bedding for winter, rehabilitation of schools, and participation in educating the thousands of children that are now out of school, partly as a result of the crisis when the Assad regime fell, and these families fled to the region. They didn't have anywhere to stay, so many of them started living in schools, and that has put the children that used to go to those schools in a difficult situation. Nobody knows when those families may move out or when those children may be able to go back to school. We heard today from the Education Authority that 8 schools that were going to be rehabilitated to hopefully help ease the situation of these children out of school will now no longer be, because the funding for that has been cut. all these gaps existed prior to these funding cuts, but they're growing. They are now wider. Partners has been standing in these gaps for years now here in Syria. And with the support of our generous community, we will continue to do so. Our work that we won't be stopping is in many of these gaps that is now widening. For example, just today, we visited a nursery that Partners constructed, and to see kids dancing and singing and having a great time with their teachers was just really impactful in this time of uncertainty and instability. We also visited a school that was previously destroyed, practically reduced to rubble, and now it's full of children back in class because of the support that our community provides to Partners. This year, we plan to construct 2 more schools to get kids back in class. In one of the remote camps where services are likely to be drastically cut because of these decisions, we're already running a child-friendly space and a hospital that provides life-saving care to thousands every year. We're also planning to provide capacity building to teachers and build methods and practices to encourage quality education over the coming year. We're planning to support a kindergarten to bring hope to the youngest kids of this region. And this is Partners standing in the gaps already. And with your support, we are prepared to widen and deepen the impact that we have here in the region. For example, over the next week or so, we will be distributing food baskets to nearly 1,000 families. Each basket will last a family at least a month. We can't meet all the needs, but with your help, we can meet more than we're currently meeting. And so far, I've only mentioned Syria, but in the last week and a half or so, I've also been in Yemen and Iraq, and the effects of these cuts are being felt in those countries as well. And we will not be leaving. We will be staying. We will be continuing our work. And we pray that you would do that with us for the sake of the communities that we are helping. So thank you.
We're really grateful to Brad for sending us that update, especially given that he's very much in the middle right now of showing up alongside communities in crisis and doing a lot of assessing of the needs, but also being there to listen to the stories and help people know that they are heard and that this community is with them and sees them and will continue to respond. Thank you to Brad and also Noom for everything you shared. I always walk away from conversations with both you and Brad really reminded of the good that is being done and that so much good can still be done. And it's a grounding anchor of hope when the suffering in the world can feel so large, especially in moments such as this, that not only can we do something about the suffering that kids are experiencing, but also just knowing that we are already doing something. We're already walking at hope. So thank you for giving us just that reminder. We're going to transition into a time of Q&A with our Director of Operations, Doug. He quite literally just returned home to Thailand from Afghanistan, so we're very grateful that you're joining us, Doug. Almost fresh off the plane and with very little sleep. It's a gift to have you here.
Thanks. It's great to be here with you.
Wonderful. Great to have you. My headphone pops up. All right, so starting with questions. I think that one question we wanted to start with that came through was, where are you seeing the biggest gaps currently based on this recent funding freeze?
Yeah, I think the needs are being felt everywhere. There's not a humanitarian situation around the world that isn't feeling the impacts of these cuts. Definitely everywhere where we work, People are talking about it. People are concerned about it, and not sure what's going to happen next. So I do think it is really everywhere. In terms of the needs, like especially as Num shared, for Southeast Asia, healthcare seems to be one of the main areas that's been cut back, and I think that's a main area of need that we're seeing. But in terms of regions, it it's really everywhere, and a lot of these places felt that need before the cuts. So, for example, uh, for the Rohingya camps in Cox's Bazar and in Sitwe, they were already had food cuts um, to their rations, so they were already in need, and something like this just makes that a lot worse. So yeah, I think really we're seeing this need everywhere.
Thank you for sharing that. Yeah, it's definitely sobering to see the cuts in Sitwe amongst the Rohingya community that have really been facing such intense violence. Just a reminder, feel free to add any questions. We'll keep going through them, but you're so welcome to continue to add more questions to the chat. Our next question is, what or who do you anticipate will fill the gap for communities that currently, apologies, that currently have not reduced to humanitarian assistance?
Yeah, so in terms of filling those gaps, on a worldwide perspective, I don't think there's any one group that can fill all of those gaps that are left. So there will be more gaps now. Um, yeah, but on a more zoomed in local level, there are different groups definitely trying to fill as many gaps as we can. So as Num said, yeah, even the Thai hospitals on the border are trying to fill some of those gaps in healthcare. Um, yeah, different organizations are trying to fill those gaps, and we are also trying to fill those gaps as best we can. Um, but there is also, I think, going to be more pressure on some of those other donors that are still there. So especially the large grants, that be more pressure on the EU to fund more of these projects. But yes, we will continue our work, and yeah, we would love to be able to do more to be able to fill those gaps as well.
Yeah, thank you. The next question is, do you think the funding change is temporary?
Yeah, good question. And that's a question that's being asked everywhere. And in the end, we don't know. And nobody knows exactly. I think the feeling with different organizations is that this might not just be temporary. And that's maybe the fear as well, is that yeah, what happens after 90 days? Uh, and yeah, will there be funding? And there's a lot of uncertainty in a lot of organizations, and it's not just organizations directly funded by USAID. It's all different organizations that might not be directly funded but indirectly funded by them, or even organizations that aren't funded by them but feel that impact in the places where they work. So yeah, there's a lot of uncertainty around that, and yeah, in the end, we don't know yeah, what will happen. But yeah, we're ready to stand in that gap as much as we can, as much as funding allows.
Yeah, it makes me think of that thing we've been talking about, of that ripple impact of how things really trickle throughout, especially in conflict zones. The next question, are most of the funding cuts due to USAID cuts? I know you kind of touched on that a little bit just then, but if you could expand on that.
Yeah. I mean, each different place is in a slightly different situation. Um, yeah, as I said, with the Rohingya camps, so they've had cuts to their rations over the last few years as funding. There hasn't been enough funding to allow for them to have full rations. So in a lot of places, there's not enough funding, or there wasn't enough funding even before this. Um, and so that all has an impact. And in some places, like Brad shared about the growing needs in northeast Syria, and that's relatively new since December last year, and so there's not enough money there. Um, so yes, it's not just about cuts. It's it's about growing humanitarian situations around the world. Um, yeah.
Yeah. The next question is, the U.S. aid freeze is greatly politicized in the U.S. and in the media. As an NGO connected to the on-the-ground situation, what would you like Americans to know about the situation?
Yeah. Um, I think that it is having a direct impact on people's lives. And yeah, there will be many people that will lose their lives because of things like the lack of healthcare. So even just looking at the situation on the Thai-Myanmar border, um, there are people that have already lost their lives because of those cuts to healthcare. So it does have a real impact on the ground. And but yeah, I would encourage you to be able to give where you can to. Um, yeah, partners has not received any money from USAID or any other large government grant. We are dependent on normal people and people around the world, yeah, giving to us. But we would love to be able to do more, to be able to, yeah, stand in that gap and to be able to help. So we would love your support at this time. Um, I think one of the unique things about partners is we are also very different um, from those larger organizations. We are a lot smaller, and we're also a direct. There's a direct relationship with, I think, our donors and the people that we help as well. Um, yeah, so yeah, if you are able to give, we would yeah, very much appreciate that support, or the people on the ground would very much appreciate that support.
Yeah, thank you. It reminds me too just how sometimes when these conversations are taking place, we can forget that there are people on the other end um, of these conversations, and that it really is people's lives at stake. And yes, there might be some inefficiencies in aid, but the need far outweighs the funding that has been committed. The next question is, does Partners do any work regarding the Thai government's and police crackdown on Burmese refugees and migrant workers?
We're not involved directly with working with Thai police or of yeah, or of that. But we do work with migrant workers and people that are coming across to Thailand. So we are involved directly with people that have been coming across, both in terms of refugees that go through to the camp and in terms of people that come for work. Yeah, we've got a number of programs to support them, including trying to get them into school or helping kids to get into school once they've come across to Thailand, to provide some emergency food. Yeah, so we've got a number of projects in that area.
Amazing. Um, Another question we have is, where do you think Partners is positioned to have the greatest impact right now?
Yeah, good question. I think in generally, like in the areas where we already work, there's a great opportunity to be more involved and to be able to do more to fill in some of those gaps. Um, as I think Num mentioned, we've got some great staff. We've got great relationships. We know these communities well, and we know their situation well. And yeah, we would love to be able to do more to fill in more of those gaps. So yeah, I do think we are well positioned to do that, especially in our areas of Southeast Asia and in the Middle East.
Thank you, Doug. Yeah, I think we are wrapping up questions. If anyone has any final questions, please feel free to share them. And I think the final one that we have is just people are asking, how can we respond? And I can take that one. And Doug, if you have anything to add, please feel free. But yeah, I think there are really a myriad of ways that people can join us, as Doug has mentioned. Financial support, if you have the resources to do so, to send relief to families. I think one of the things that makes Partners really unique and something that I'm continually amazed by is how short the time and distance is to between when we receive resources and how quickly support then gets to families on the ground. We often say, we distribute what you give. And I think that really genuinely captures how Partners works. And the nimbleness of our community, because we're small, because we're connected to the community, we can move really swiftly. And so we just welcome that, and just know that the support that you provide really does have such a swift and huge impact on the lives of kids and families. But there are also a lot of other ways that we can get involved. You are always welcome to host gatherings or peer-to-peer fundraisers. And this is where I think we really get to see the creativity of this community come out. We've had people who have hosted benefit concerts. We have people who've done, backyard dinners. People have hosted bake sales, all to raise awareness and support for communities. If this is something that you're interested in, definitely let us know. We also are just so available to have a conversation. If you're hearing this conversation and you're like, oh, I wish so-and-so could hear this, please reach out to us, whether, that's your book club or, your pickup basketball group or your water cooler group at work. Our team is available to connect with you and explore how we can help come and share, whether that's remotely or online. We really want to help collapse any gaps that people might feel between people getting to hear about the work and really connect with it on a deep level. There's also a lot of opportunity around, we have a new social media ambassador program called KIN. So if you really enjoy social media and want to use that as a tool of advocacy, that's another way to get involved. But really, I would say just know that we're here to have a conversation. So if you're feeling that tug of, I really want to do more, but I'm not quite sure where to begin or what that looks like, I just want to say, that's a really beautiful place to be. It's a beautiful place to start. And please feel free to reach out to us after this webinar. We're a community and we really love getting the opportunity to talk through and dream together how we can build this movement of love. And I'm going to check just if there's any final questions. We have one, Doug, if you can take this, and also if there's anything that you want to add on to what I said, feel free. But one is, are you able to work in Gaza at all at this time?
Yeah, so we have done a small amount of work in Gaza through partners that we have there, mainly providing emergency food. We were also providing some emergency water, and a well. So we have been doing some work in Gaza, and yes, we're able to continue that work. It's a little bit more unclear, I guess, the situation right now. I know more aid is getting in at the moment, um, since the ceasefire, and so yeah, we're kind of looking and seeing what the situation is at the moment. But yes, we have been able to help there, and yes, we can continue to work there.
Thank you, Doug. And thank you everyone who submitted questions. If you think of something afterwards, or if, like I said, if you just want to have a conversation with us, know that we're here and you can get in touch. We have our info@partners.ngo email that you can reach out to and connect with a member of our team. Thank you, Noom. Thank you, Doug. Thank you, Brad, who's asleep right now. Just really appreciate all of you and your heart and the wisdom and knowledge that you bring to this conversation. And thank you, everyone who just took the time to be here and spend your evening with us. Community is really the heartbeat of what we do. And it's not only deep relationships and connections in the communities where programs are taking place, it's also here with those of us who are building solidarity and compassionate support. It is really just a joy to do this work with you. It's a joy to be reminded that we're not alone in our hopes and dreams for a world where kids can really thrive and be free. So yeah, thank you again for taking the time to be here. Thank you for being a people of love who are really working to build a future of hope. Take care, friends.